Hello there. How are you doing today? Oh, I'm sorry to hear that. You're not feeling so well. Oh. Okay. Well, we can kind of take a look at that while we do your regular cranial nerve exam today, okay? So I can help do both today. Is that okay with you? Excellent. Okay. So I think first things first is, as always, we are going to use our little stethoscope here to just kind of see how your breathing's doing as well as your heartbeat. And this will be good for both. It will be able to tell if there's something on the inside that we should be looking at carefully, okay? So let's start with just this, okay? And if I can just get you to just take a deep breath in and then just let it out. Normal breathing afterwards while we listen in, okay? Okay, and we're just gonna have a look just on this side as well, okay? And deep breath in for me. And let it out. Once again, I'm just going to put this on the back of you, okay? And just another deep breath in. And let it out. And we'll have a listen. Okay, and just last one on this side, on the back too, okay? And just take that deep breath in. And last time, let it out. Okay, so it does sound like you are sick on the inside as well too. So we are going to just take a look through the cranial nerve tests that we do throughout this appointment, okay? And we will incorporate some medicine techniques as well as some things to maybe relieve some of the pressure and maybe make you feel a little better, okay? Depending on what your symptoms are. Okay, perfect. That sounds great. We will make sure that you feel better at least by the end of the appointment. If not, waking up tomorrow morning feeling rejuvenated and better. Fantastic. Then let's get started too. I'm sorry, what was that? Yes, okay. So you did mention that you did have an arm injury that you had wrapped and you just wanted to re-wrap it as well. We can definitely slide that into today as well. No problem at all. Okay, so I think we'll get started with just the first cranial nerve exam, and then we'll proceed and kind of just dabble in each of the areas, the cranial nerve tests, as well as the trying to find ways to make you feel better today. Okay? So let's dive right in. Okay, and I think because you are also under the weather, I think what we'll do is start with the smell test as well as the tasting test, because usually when you're not feeling well or you're feeling a cold or sick, taste and smell seems to be the first things that go. Okay, so we're going to see where you range at for those tests first, starting with our smell cards. Okay, our scratch and sniff cards, if you will. So we've got 5 of these scent cards, each having a different pleasant scent, and I just want you to tell me if you're able to smell that through the not feeling well. Okay, okay, perfect. Here we go. So now these do need a little bit of a scratching, so just bear with me here. And what does this smell like? Yeah, of course you can have another smell. What does this smell like? Oh no, you can't smell it at all? Okay. Well, luckily this is just the start of the test, so the scents at the beginning are a little lighter than the ones more towards the end, okay? So let's jump to the next one and see if you can get that scent. Okay, we have our next here. Give that a sniff. Can you smell this one? No, you can't smell this one either? That's okay. We'll see. I'd be more worried if we get to more of the end ones, so we'll just keep going, and I'm sure you'll get a scent very soon. Okay, and now we have our third scent here. smell like? Okay, you're smelling something, but you can't quite make it out. What if I gave you a hint? Okay, think floral. Yes, lavender, you are correct. Okay, so you are picking up some kind of scents, but more of the heavier ones, if anything. Well, that's relieving for both of us, I can imagine. So let's move on to the fourth one and see if you can guess that one. Okay. Are you ready? Let's go. And can you smell this one? Okay, you're picking up a scent again. Okay, let's see if you can get this one. Yes, it's a more sweeter scent. You are correct. Oh, so close. It was orange. Okay, the scent of an orange. But that was very close. Good job. And for the very last one, scent card here. And what does this smell like? Yes, you are right. Strawberry. Looks like your scent is catching on to some of the at least stronger scents, so that is very positive. And next, we are going to move on to the taste testing here. We're going to see how your taste buds are doing. Using this bottle here, it's got 3 compartments in it, and we're going to be using each 3, one with each different taste. It needs to be nicely shaken up as well. And I'll just have you stick out your tongue there. Perfect. And can you tell me what that tastes like? Yeah, you want one more? For sure. Still having a hard time telling what taste it is? Okay. That's okay. Just like with the scent cards a lot, with the taste testing sprays, it's similar. It starts off with a more lighter taste and then kind of works its way up. So we'll switch over to this other one here. Okay, cool. There we go. Now that we got the second one activated in here. We are going to get this next taste ready for you. Okay, are you ready? And if you'll just stick out your tongue there. Okay. You kind of have a taste of it. Okay, so one more spray. And what does that taste like? It's very close, very close. I would say it's closer in fruitiness, but not in earthiness. But yes, that is almost there. Let's try this last one to see where your taste buds are at. Switch it over to this third flavor here. Just drop that. Sorry about that. But now it's switched over to the third taste here. And we just got to give it one final shake. Okay, perfect. And if you'll just stick out your tongue. One more? Yeah, absolutely. Now, can you tell me what that tastes like? Mangoes, yes, you are correct. Excellent. Okay, so you can taste. It's a more stronger taste. So I think that steers us clear from the you're unwell not being tied into anything too serious. I think it's just a common cold, if anything. But I think this is good progress so far, so we know what the severity of it. Okay, good. I'm glad you're relaxed too. Just while I've got you relaxed, I'm just going to quickly fix those bandages. Okay, just going to do some fresh bandage here. Okay. Going to wrap that around here. Okay, good. Just going to keep wrapping this around here. Okay. Make sure that's nice and tight there. Okay. And then a few more turns around here. Just to keep that nice and bandaged there. Okay. And I'm just going to cut off the remaining bandage that we don't need here. Okay, perfect. So we use just the right amount. So now we've got that taken cover. We'll just move on to some more of the cranial nerve exam tests, okay? Perfect. And the next one, we're just going to be using this eye chart here, okay? Just to test out your vision. And we can see where that is, okay? How are you feeling? You're feeling all right? Okay, good. Good, I'm glad. Okay, so we're just going to start right up at the top here. And just write, and if you can tell me what this letter is here. Good, good. And we're going to jump down to the second line now here. And if you can just read them off for me on the second line. Very good. And we're just going to jump down to that third line now. Very good, very good. And the fourth. Very, very good. And the fifth here. Excellent. And this sixth here. Perfect, perfect. That is excellent. Now, if you could tell me what colors you see on this chart. So, just with your eyes here, which colors do you see on the chart here? Okay, perfect. Yes, we see green. We see green here. And then right here, yes, very good. We have some blue. And down here we have some green again. Yes, correct. And jumping down to the last one here. What color is this one right here? Very, very good. Okay. So for the last two lines that we're going to try, for the seventh line, I'm just going to point to certain letters, and I'd like you to tell me which letters I'm pointing to, okay? I'm going to go out of order. Okay, so if you can tell me this. Good. Here. What about this one? Here. 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 Very good, very good. And on the eighth line here, on this eighth line, I'm going to get you to do the very same thing, okay? So with your eyes here, I just need you to tell me which letter I'm pointing to, and it will not be in the same order, okay? And so, very good. Good. Yes. Very good. Very good. Very good. Yes. Correct. Fantastic. You have done it. Now, can you tell me what these letters are here? Just read the ones off that you can read. Just read any of the ones off right here. Okay. Okay. So you can see a few of them, but not the whole line. Okay. Perfect. Well, all we needed was for this line right here for you to be at 20/20. So everything seems perfectly normal with your eyesight there. Okay. Fantastic. So I think we're just going to move on to the next test here real quickly. I will just get this out of the way here. Okay. And I think the next test we're going to do is the hearing test, okay? And we're going to be using different objects for that as well. I'm going to be using an object, and I just would like you to tell me when you stop hearing this object, okay? And it will start right now. Very good, okay. And just on this side as well. Tell me when the sound stops, okay? Very good, okay. We're just going to come back to this side now and do the very same thing. Very good, okay. And just one more time on this side here. Very good, very good. It seems like your hearing is in perfect working order, as well as your eyesight. So it seems to me the more tests that we do that your illness is just a basic cold, okay? So I think the most recovery thing you can expect from this would just be having a lot of rest, making sure you're sleeping a lot, making sure you're getting a lot of fluids in, okay? And just kind of rest it out in a way. The more you relax your body and just let it work its way through, and the less that you fight it as well, it should go away pretty quickly, okay? Now we just have one remaining cranial nerve exam, okay? So I'm going to jump onto that real quickly here. And this is basically the nerve of feeling things, okay? Feeling touches, feeling pokes, feeling brushes. It's the nerve that tells you that your body is feeling like pain receptors, as well as just a simple poke, making sure that all those nerves are active and well versed, okay? Okay, perfect. So I'm just going to start by just brushing on parts of your face, okay? And I just want you to tell me what part of the face that I'm touching, what part do you feel it on your face here, okay? Yes, very good. Excellent, very good. Very good. Very good. That is correct. That is correct, yes. That is correct. Right there, yes, perfect. That's what we're looking for here. This nerve also seems to be in well order as well. Perfect, perfect. And you can feel this one right here as well. Okay, good, good. That is what we are looking for. That is exactly what we are looking for. Very good, very good. Now I'm going to switch to the other side and just give little taps on your face, okay? And I want you to tell me where those taps are, okay? Perfect. Very good, very good. Very good. Okay, yep, right there. Good job. Excellent. Okay. Okay, good. And just right here. What about right here? And right here. Okay, you do feel that. Good, good. Okay, so it looks like that nerve is in perfect working order. So like I said, it is just basically a quick flu or a cold. So just get lots of rest with lots of fluids, okay? And on top of that, your bandage and your wound looks like they're healing up perfectly. And on top of that, your cranial nerves seem to line up perfectly with the recovery. Oh, it's my pleasure. No problem at all. Okay, well, you take care, and I will see you on our next appointment. Dr. Relaxa always cares about your relaxation and your well-being. Absolutely. Take care, and I will see you next time.